Hi guys, Nurse Jilla here. Come on, nurses, step into my office. Have a seat, relax. Do you feel frustrated, like you don't want to go to work? You feel burnt out, overwhelmed, feel like you've hit rock bottom in your career? You're crying in the locker room, crying in the closet, feeling like there are no changes, feeling like you're not doing enough to help those around you. And if you're feeling that way, it's okay to feel that way. It's okay to, however you're feeling, it's real and it's valid. And if you're feeling like it takes every energy and strength out of you just to get out of bed and just to make it to work, just stop and reevaluate what's going on in your life and what's causing that, and how can there be a change in your life. And if it's a staffing issue, try advocating on behalf of yourself and your unit. It's very important to use your voice as nurses to speak up, and your voices, sometimes you might feel like your voices are not making a difference, but it does. And if you're feeling like you don't want to go to work and you're overwhelmed because of the acuity of the patients, or because it's just very hectic, think about what's causing it to be hectic and pinpoint at least one thing that you can do to make it better. Reflect on, why did you become a nurse in the first place? Sometimes you might just need a counselor, you might need a therapist, you might need somebody to talk to and open up about what's going on in your life. Nursing is a very stressful job, and it's so easy to get burnt out, and it's so easy to take on a lot of different problems. The first thing, if anything happens, who's the nurse? And you have to know that you can do it. Millions of people do it. You can do it, and find your inner strength. But you also have to know when to draw boundaries, when to set boundaries for yourself. And when you leave, don't take the problem home with you. It is hard to walk out of those hospital doors and just say bye bye problems. But I've learned over time that you just have to try to let work be work and home be home. When you're at home, you focus on your home, your family, your friends, the things that you love, your pets. When you're at work, you focus on work and you excel and do your best at work. But when you leave those hospital doors and you're taking home work with you, it's very stressful. I try my best to, whatever it is I need to document, whatever it is I need to do, I do my best at work. I I do my utmost best at work, and then when I leave, I like leaving with nothing on my mind, to know that, okay, I've given my best. I'm not saying somebody won't email you at home, like a manager will email you, hey, this documentation was missed, or I didn't see this, what happened? I'm not gonna say that's not possible, but that's not something I want to do every time I leave work. That's not a priority of mine. When I leave work, that part of my brain, I want to be able to shut off and just focus on life outside of work. And it is so easy for us nurses to take that burden home with us. And if you're going through that, if you're finding yourself overly frustrated, and if you're finding yourself feeling like you don't want this career, you don't want to be a nurse anymore, it could be the career itself, and it also could just be you. So take the time, and this is not just for nurses. healthcare workers in general, this is a very stressful position where you have a lot of responsibilities on your shoulder. And but you have to be able to separate your work life from your personal life and find that balance. And if you don't know how, feel free to message me. I could give you some pointers. Seek out different counseling resources to help you with that. I mean, talking to a friend, another nurse friend, somebody you can trust. There are many days I've had a stressful shift, and I just call one of my trustworthy coworkers, and I call an event, and I get it off my chest, and I move on. And it really helps. Don't bottle it up. You know, imagine having a patient who you were bonding with and close to, and then by the end of the shift, they're gone. That's a lot of mental stress. That's a lot of toll, knowing you put, all your effort and all your time into loving and caring for this patient, and it was just their time. And how do you move on from that? How do you heal from that? And it's just learning a balance, finding your inner peace. And sometimes you just need a career shift. You're doing something and you feel like, wow, this is just not for me. It's better to find out, and it's okay to try different things. Like, I've tried so many different things. So I've had like my one job, my first job ever as a nurse. I still work that job, and I love the hospital that I work at. But I try different units. Not all the units are for me, not definitely. But there are some units that I like more than others, and I experiment and I try different things, and be adventurous in your career. Don't be afraid to try things. Because that's an opportunity for you to learn. That's an opportunity for you to be a better you. And I love trying new things because I'm learning and I'm growing. Each job is teaching me something different, and I'm meeting different people. But sometimes you have to identify when you're getting burnt out, and you have to know when when you need a break, when you need to step back, and it's okay. As nurses, we are so hard on ourselves. We're so forgiving and compassionate to others, but we are our hardest critics, and we gotta have grace on ourselves. When you hit rock bottom, get out the bed, wake up, go for a walk, go do something. I'm telling you guys, your mental health is so important. If your mind is not in the right place, if your mind is not in the right place, I will repeat it, you're not going to be able to be functional. You're not going to be able to be successful. You're not going to be able to do all the things that you have. Start dreaming again. What is it? Why did you become a nurse? I know I've said that in a couple of other videos. Why did you become a nurse in the first place? You have to go back to the basics. You have to remember your passion. I remember, this is one of my stories. When I was in clinical, I had a patient that was contracted, both arms, both legs, and had bed sores. And I remember asking my instructor, what is wrong with him? Why? What's on him? Like I said, my background is babysitting. I did not have a healthcare background. And I was so traumatized. Like, his arms aren't moving. He has all these wounds. What happened? They're like, oh, he's from a nursing home. He wasn't getting a lot of mobility. He got contracted. He wasn't getting repositioned often. And I remember thinking, I want to go to the nursing home and save everybody from getting bed sores and getting contracted. And that was just my passion in nursing school. I'm gonna prevent all the bed sores in the world. And not to say that, you know, they're not wonderful nursing home out there, but my point is that's that ignited my passion to want to save all these bed sores and prevent. That's why even now in my career I'm passionate about encouraging patients, reposition yourself. You don't want to get a bed sore, move your arm, move your legs, and go back to why you became a nurse. You know, you work so hard. Don't just give up on your career. Don't just, when it gets hard, don't just toss in the towel. Believe in yourself. And for those that are upcoming nurses, I'm telling you again, that's the most important thing. You have to believe in yourself and know that you can do it. If I can do it, you can do it too. Bye guys. Have a wonderful day.